हे बच्चों, क्या हाल चाल। हे गाइस, कैसे हो आप? Hey guys, can you see me? Can you hear me? Hey, sorry. Hello guys. Am I audible, visible? The ad is going on and on. I can't see myself. Rabia, this is primarily for anyone who wants to know what is happening inside the lab, right? So this is not primarily ear focused. Apologies, I was initially thought that streaming is not on and I was looking at the camera and the YouTube links. Okay, so guys, welcome back. I'm going to kind of divert from the pathoclinics of the Decode CBC series, what we had a couple of episodes and last week. Based on your guys' input, I'm going to see and show you what actually happens inside the lab. We have like 4-5 videos or 4-5 classes on this. One, the first thing will be we'll be talking about simple normal light microscopy, fluorescent microscopy, the variations of light microscopy. We'll also look at electron microscopy. Hi, Sri. Thank you, Tala. Thank you, Rabia. So, and also we'll look at what does processing means, like because pathology is not always about hematology. Hematology is a division of pathology. We have cytology, we have FNACs, we have immunohistochemistry, we have flow cytometry. Right? We'll tinily like every single video, maximum 20-30 minutes. We'll look into what are these in depth, because in core pathology we don't read them, and sometimes, especially in an exam like an INICT, how many of you guys you think you want to sit in Ames Delhi? Comment. If you comment yes, there's a possibility you might sit, but I want you guys to be open about it, right? So in INICT exams, they do little bit emphasis about this. I'm not saying this is without this you cannot score a good exam, good mark, but with this there's a possibility you can be in the top 10, right? So that is the reason why we started the series. So what is there inside the pathology lab, right? So first thing is a simple normal light microscope. We're going to talk about simple normal light microscope today, right? Anyone, you must have seen normal light microscopy, right? Be it first year, second year, anyone. No one wants to sit in Ames Delhi. There's no comments I'm seeing. Come on, guys. I thought you were better than this. Come on. Make a loud shout out. How many of you want to sit in Ames? Okay. You might have seen a simple normal light microscope, right? So tell me first things. Tell me first things. Tell me what type of microscope you have seen. You have seen a uniocular microscope or a binocular microscope? Because I feel when you go in the first year of MBBS, most of them must have had uniocular microscope, right? When you go to the second year onwards, you might get transformed to a binocular microscope, right? When I say uniocular microscope, binocular microscope, the eyepiece, right? You can see here, there are two eyepieces here, right? We call them an eyepiece. Sometimes it'll be only one. In a second year, generally it will be a two eyepiece, right? So one eyepiece, the concern is you will just close one eye and look into the microscope with the other eyes. It will cause a headache. The problem is second eyepiece is you will not be able to focus properly, so that you might see two images, or you might not be able to focus the images properly, right? The goal here is to how to use a microscope and what are the important points, and if at all it comes to viva, you will be able to answer a few questions. Hi Ali, hi Munir, how are you? Okay, that's a goal here, right? So now I'm just going to talk about the various parts of the microscope which you have to know, and a little bit about the use cases and where all we're going to use it, right? So first and foremost, starting with the top part is eyepiece, right? This is not much of a requirement, But next time when you go there, when you go to your lab, this can rotate, right? We call this head, like my normal head, this head also rotates. Why is this required? Let's say there's a table where your pathology tutor or your professor is sitting and they are looking into the microscope, right? And you are standing on the opposite side. I want you to see the same part. If I move, you come and stand, you might disturb this field, everything might get disaligned, right? So what you do is, there might be a screw, go and see, it can turn. So this part can actually turn, so the eyepiece goes to the opposite sides. So both the people can view. That's the purpose here. Head actually, like a normal head, can rotate. So that the view of the person can be, both the people can view the same view. It won't have any disturbance. That's the first thing. How I want you guys to go and try next time when you have the pathology practical, but please don't break the microscope. They might penalize you, right? That's the purpose of the head, right? The next what we have is nose piece. Nose piece is something where your objective lenses are plugged to, right? Actually, when you disassemble a microscope, this part, this part can actually be separated, okay? So in that, you'll have the long lenses attached, right? Can anyone tell me how many lenses were there in the microscope, what you saw in your college? 3 or 4 or 2? When I say lenses, these are the lenses I'm talking about, the long ones with colored lines, no? How many lenses does your microscope have? 2, 3, 4. There are possibilities your microscope might have only 2. A good microscope might have 4. There are very good microscopes which can also have 5 objective lenses, right? There are maximum 5 objective lenses available, right? Most of the microscopes will have the objective lenses 2, okay, 2. Stuff, sure, we'll see. Okay, so yours is only 2, okay? You have 4x, you'll have 10x, you'll have 40x, you'll have 100x. This is general normal microscopes. If it's a good standard quality, you'll have these 4 objective lenses. If it's a consultant microscope, right, when I have to report, for me 40 is too big and 10 is too small, there's a possibility you can have 20x also. There are possibilities that I can have 5 objective lenses stuck to the nose piece which can be rotated, fine, okay? Sure, I told you yes, okay? That's one. Next is coming to my mechanical stage. We look at each and individual stages and each and individual use cases separately. I'm just going through an overview here now, that's all, fine. So in this stage is where you keep the slide. I'm sure you must have done that. You keep the slide, you clip it, put the slide, and you can move. This stage moves. It can move in this axis, it can move in this axis, both X and Y axis. The purpose of the stage is not just to hold the microscope. There's one more purpose. Have any of you noticed this? If any of you notice this, tell me yes. Have any of you noticed this? In this stage, in one corner, you might have markings like this. Have you noticed them? To be very specific, like a vernier caliper, what you must have read in physics, there must have been markings, right? Thank you. Hope you're doing good. Yes, there must be. There will be. If you're not noticed, tomorrow when you go to the practicals of the pathology or microbiology, wherever you see the microscope, go and have a look. There'll be markings. The markings are very important for me. Why it's important? We'll see them very soon. Stage has 2 purposes. One is to hold the slide and also have markings. The use case of the markings we'll see very soon, right? Then I have the adjustments. Fine in the course adjustments. Yeah, perfect. Like a scale, like a scale, like Ashraf, right? Like Ashraf said, it's like a scale. So I have coarse and fine adjustments. That also is a part and parcel of the big microscope. Sometimes coarse adjustment screw and fine adjustment screw will be different. They won't be the same. But if you look in this microscope, this is coarse, this is fine. Sometimes these two can be in different knobs for us to rotate. Coarse will move the entire stage up and down very much. Fine will move it slightly just to focus, like a camera. Zoom and then focus. Same way, coarse and fine adjustment, right? And these are my stage controls, which can move the stage into x-axis and y-axis. We have a knob below it, right? Then last but not the least, we have you have the diaphragm. You can call it an iris diaphragm or a diaphragm. I want you to remember iris diaphragm because it does the same job like my iris. It will squeeze, move, so that it can focus the light. The light comes from here. You can focus the light and push the light exactly into the specimen or the slide, whatever you kept, right? And you have the on-off switch here, and the brightness adjustment also might be there, right? Okay, I'm looking at the last few letters, so that stuff. Okay. Okay, so these are the normal parts of a microscope, right? Now, like I said, I'm going to go to individual parts and explain it a little bit in detail, because there's a very high possibility, especially in the first internals, they might ask you what are you seeing. If you answer everything in the slide, they might ask you go and answer the microscope, right? Okay, the first thing is stages. Stage use, first and foremost, we'll have to clip it like this. By default, you clip a slide here, it holds the slide. These are the scales which Akib said, right? Scales. You'll have measurements. The use cases, now, though you are a bit young into your second year, I am sure you will try to answer this question. Cancer is an invasive lesion. Yes, no. I at least want yes, no from you guys. If not, I'm not going to continue this YouTube series. I want comments. If you comment, you write, tell the right answer, you will be happy, I'll be happy. If you tell the wrong answer, you'll remember for a long time, right? Cancers are invasive lesions, yes or no? Undoubtedly, yes, it's an invasive lesion, right? Now, let's say I have a breast cancer. Fine. I'm just trying to explain you what is the use of the scale here, okay? I have a breast cancer, right? Perfect, great. So now you have this big of a lesion. There's a breast parenchyma which has been excised. Fine. Hi Hussein, hope you're doing good. And you have a breast cancer here. Okay, I've removed as a part of the surgery, I've removed the condition, right? Now, this is the corner of the surgical specimen. This is the corner of the tumor. This centimeter or the gap should be measured, yes or no. I'll tell you the logic behind it. If the lesion is close to this, can I say I have left something in the body? Because I have removed this outside the body, telling I have removed the cancer completely. So if it's very close, which means it is touching the resection margins. If it's a little bit far away, it is okay for me. 5 millimeter is what I look for. 5 millimeter, just half a centimeter gap should be required from the lesion, from the resection margin, right? So if in case of every cancer I can do, but for breast cancer, I gave us an example, that's all. So when I say this is the tumor, and when I say this is the resection margin ka matlab, it is the surgery which has been done, which has been removed. I need a gap. I need minimum of 5 millimeter. This will differ from different surgeries. Some surgeries may require only 1 millimeter, some might require a little bit more, right? Okay. Feelings by me. Hi, hello, how are you? Okay, so to measure that, I need the stage. The stage has two uses. One is obviously to hold the slide, right? The second thing and the most important thing is to measure the margins. That is important. Sometimes even the lesion. When you go to cancer chapter, we'll read about something called as grading. Right? Grading means I'll tell our tumor is 2 centimeter big. How do I exactly measure? I mark them in the slide using the scales. I can measure them, right? That's a job here, right? I have two jobs for the slide stage, right? Next time I want you to go to the lab, look at the markings, maybe keep a slide and try to measure it just once, fine, perfect. Akib, I will not use the length of the specimen. That will be gross. I'm looking at the microscope. I cannot have the entire specimen in the microscopy. Maybe length of the lesion. That will be an appropriate one, right? Next is eyepiece. Tell me honestly, again comment. Do you find difficult whenever there's a two eyepiece to find a single image? How many of you felt this problem? There are two eyepieces. Though there are two eyepieces, I still close one eye. I look with only one eye. How many of you do that? Most of the second year MBBS does that. First year also you do the same. Na? You close one eye, look at one eye. That is one of the biggest resistance for pathology. Because it will cause headache. You look into like this in any place for 5 minutes, it will cause headache. The goal is, how do I make sure eyepiece works properly? Next time when you go to the lab, do this. If they are not taught you, do this. You can actually see beautifully through both, right? It's a simple concept of light, what you read in physics, that's all, right? Now, what you do is, let's assume these two are my eyepieces, fine? If you have noticed, this is the place where both the eyepieces join together. So I can expand the eyepiece like this. I can contract the eyepiece like this. You must have definitely noticed. So before starting to view a microscopic slide, pull it far away, okay? Then put both your eyes together and then bring it close. The moment you see a single image, that is your intercanthal distance. if the distance between these two is equal to your intercanthal distance, this my eye's distance, it will be perfect single image. So the first thing, switch on the microscope, switch on the slide, switch on the light, pull it apart, slowly bring together. At some point of time, you will see a single image. Stop there. This will differ for every person. So every time one friend moves it, you again pull it away, come close, pull it away, come close, right? If the eyepiece length is equal to your intercanthal distance, you will get a single image. So you have to pull it away and then you make it close, pull it closer. Wherever you have a single image, you will get a single image. Maybe first time you might not, but definitely with practice it will come. That is the best place to view a microscope, so that you will not have a headache. Subject itself is a headache, right? On top of that, the viewing is also causing a headache. I'll have a problem, right? Generally, most of the microscopes, this also has a magnification of 10x, right? It's a 10x magnification, okay? 10 times it magnifies. It has a lens here. The lens gives an 10x magnification, right? Why this is important is, when you see Robbins images, or when you see any pathology textbook images, it will be written microscopic image of 400x magnification or 1000x magnification. How do I come to 1400? For that, this 10 is very, very important, right? This is my first lens. Second lens is this guy. These are objective lenses, right? So like I said, there's a nose piece and these are objective lenses. Okay. Have you noticed the color in the objective lens before? You might have. Everything has a color, and also it has a name written to it, right? The number written to it. There are two numbers. I'm going to focus on only one number, the normal, not the dots and the numbers, the full numericals, right? 4, 10, 40, and 100, right? 4 is something called an scanner view. Whenever I talk or whenever your teacher talks, scanner view, you see this. That's a 4x, right? 10x is low power. We call it low power field. These are very, very important, especially when you grow into systemic pathology or any part in surgery. These are important terms. 40, this lens 40, right? This is 40. 40 is high power field. Okay. So whenever you go to neoplasia, we'll call it HPF, high power field. So in high power field, I count mitosis number. HPF is high power field. That's where I count the mitosis number. So when I see in 40x, I call it high power field, right? And last but not least, 100x is your oil immersion. So these are the 4 lenses which will be there. The color code also will be similar. You'll have red for the scanner, yellow for the 10x, blue for the 40x, and white for the oil immersion, fine? Hi John, hope you're doing good. Okay, Lassia, like I don't think so. The diameter of the eyepiece matters. Even though I have a bigger eyepiece, the lens will be the same. See, you might have this big spectacles, but the power, my view of vision is going to be predominantly here, right? So the center part, which I'm going to focus, will be smaller. Doesn't matter whether you're a bigger eye or a smaller eyeball, fine? Okay. That's how it will be. If you want, there are a few adjustments for you to keep it, but that's not required. You'll get used to it if you work on it for some time, fine? Let's go to this. So these 4 objective lenses has 4 different magnification power, 10, 40, 100, and 4. Now when I look into a slide at 40x, this objective lens, what is the magnification power? Anyone? I'm going to look at a slide with slide here. Let's put a slide here and say I'm going to look at the specimen at this blue lens or the 40x or the high power. How many times do you think it is getting magnified? Anyone? How many times do you think it's getting magnified? It's getting magnified 40 or more? It's getting magnified 400 times. Why? I have this base 40 and I'm sure you remember this. I have this guy. So when someone asks what is the magnification power of a scanner, it is 4 into 10. When I say magnification, the scanner view magnifies something of 4x of the objective, plus don't forget this, the eyepiece has already 10. So the magnification power is 40 times. Scanner view will magnify something 40 times what you see with naked eye. low power field was 10. This is objective power, right? And this is again 10. The eyepiece power is always constant, is always 10, right? It gives a 100 times magnification. A high power field, HPF, that's a 40 X lens, the blue lens, right? There's 40 here, there's again standard, it gives 400 times magnification. And oil immersion is 100 here, it's 10 here, it gives 1000 times magnification. The maximum I can magnify with respect to a light microscope is 1000 times. Beyond that, I cannot magnify. We don't have the power for a light microscopy to magnify. If I want more magnification, we can go for an electron microscopy. Okay, fine. Now, resolution. This question must have been asked in physics and also in first year. Na? What is the difference between magnification and resolution? Simple. You take a photo image in your camera, mobile phone. You keep on magnifying it. After a point of time, it will become blurred. Blurring means it's not having a good resolution. I can still magnify, keep on magnifying, but I won't see properly. Resolution, if you remember physics, it's the limit like at which I can see 2 points as 2 distant points. That is resolution, right? So let's say there are 2 points in this dot. I have made a dot here, but there are 2 dots here. Okay, this is, I'm seeing them as 2 different dots. That's resolution, right? So resolution is different from magnification. Magnification maximum can go for me 1000 times, right? Resolutions, if they want a definition, ability to distinguish 2 close points as separate, fine? And the ability to distinguish 2 points as separate points. They are separate, they are very close, but still they are separate points, right? And the resolution power of a light microscope is 0.2 micron. So beyond this, like if it's a nanometer, my light microscope can't do anything. I need an electron microscopy for that. My light microscope cannot distinguish it, right? So that is my resolution, and magnification maximum can be 1000x, fine? Now, next. Then below the stage, there's something called a condenser. See, this is where from which the light goes. Generally, most of the microscopes now have LED bulbs. Very rarely, maybe in first year sometime, you must have been given a mirror where you look at the sun, it reflects and comes to the microscope slide. That's long gone. We don't have, I hope they don't have those microscopes in your college. Most of them are LED source. You'll have a button here connected to the plug. That's how the light comes, right? So this light, it's like a normal tube light. It gives a wide light. But slide may, let's say you have a slide of, you must have seen sites of acute appendicitis, now. You'll have only here, the specimen. But the light source will give light everywhere. I don't want everywhere. I want them to constrict and fall only on this, because rest everything is waste for me, right? That's where iris diaphragm comes here, right? This person is holding this tiny rod. If you can push, slide it. It opens, it closes. It opens, it closes, right? So this diaphragm or iris diaphragm's function is to focus the light. Focus the light on the specimen. Whatever is there in the slide, you focus light on specimen. That's the job of iris diaphragm, and it will give a little bit of better clarity, good image view, because the light is exactly focused there, right? Okay. This condenser can also be moved up and moved below. Might not require for undergraduate. When you go to postgraduate time, some refractile property is based on moving up and down the condenser, fine? Last but not least, these are my coarse adjustments, and these are my fine tuning adjustments. You must have seen that you can move it bigger, smaller. These are adjustments so that the focus can be perfect, right? Now this about a simple normal microscope. What we are going to see in the next 3 slides are slight variations from a normal microscope. I'm not going to go to the electron microscopy thing. Simple slight variations from a normal microscope, fine? The first is Brightfield microscopy is a normal light microscopy, right? So what normal light microscopy does is, there's a light source from below. It sprayed the light through over. We had the condenser lens. That's your iris diaphragm and the condenser, right? It went on the slide. This is a stage where the slide is there. Then I have the objective lens. Then I have the eyepiece, right? So the light beam goes like this, falls on the slide, and then goes to the objective. I look at the eyepiece. So it gives me a color. Whatever based on the stain, I see them, right? There's something called a dark field microscopy. As the name says, dark field. The biggest difference is the background of dark field microscopy will be black in color, right? In the center, there'll be few shining spots. Entire background is black. In the center, there'll be few shining spots. And I also tell you what is one use case at least you have to remember for dark field microscopy, right? The only difference here is I have something blocking here. The same light, but it's been blocked by a center aperture. It splits the light. So if you block the light in the center part, what happens? It goes to sides and reflects. So the main specimen will not actually have it kind of intersect and go like this. It won't be picked up by the objective. If you look at this, the light comes here, goes here, it escapes. It's not going to the objective. If it is not going to the objective, what will happen? I won't have them in the eyepiece. So the bright light is not coming in the eyepiece. It'll just hit at one narrow point. And if I focus that point alone will be bright. Rest everything background will be black. That's the concept behind dark field microscopy. Do you guys understand? Okay. John, the same reason. It's crisscrossing and going away, right? So normally light goes like this. I'm seeing it. Light travels in a straight line. You know that, right? Cannot bend. That's a property of light. You must have read in physics, right? Now light comes like this. I can see. But light goes like this. The center part will be black. The light escapes the objective and goes here. Because I put a center aperture, the reflection is like that. So only the point of intersection, wherever it crosses, that's where I keep the specimen. That part alone will be a little bit brighter. So dark field microscopy looks like this. Have you guys heard about a disease called syphilis? Yes, no, maybe. Might have heard about syphilis, right? So syphilis is an organism called as trichomonas. Treponema pallidum is an organism which causes syphilis. Okay. So this is the organism. It is a very like a corkscrew like an organism, like slender, kind of an S shape like a corkscrew. Anushama will talk more about it. Treponema pallidum, it's a very thin organism. Imagine it's a very thin line. I can't see in a bright light. That's why I make the background dark. It's a completely dark background in that even a thin organism can be seen. Right? Treponema pallidum, entire group of treponemes, or the bigger group is spirochetes. There's a big group called spirochetes. Underneath we have Treponema pallidum. I can see them. This is a beautiful use case of dark field microscopy. There are little bit more use case also in microbiology, and Shama will talk about that, right? Next is phase contrast. Need not read the technicalities of this. The difference in phase contrast is instead of having a center aperture, it splits differently. This is the only change which happens. Light source comes, it splits the light and sends it upward. The thing with phase contrast microscopy is, let's say I have a cell here, fine. In this cell, I have a nucleus here. I have a mitochondria here. Will you accept that when I say a nucleus is sort of dense, mitochondria is a little bit lighter? Because nucleus is full of chromatin, mitochondria is a little bit of membrane fluid and everything. So both of them are different in density amongst the structures, though they are cell components. Cytoplasm has a different density. Peroxisomes might have a different thing. So what happens is, when the light hits here, it gives a different output or a different image. Okay, great, Mohit, all the best. The light hits here, it shows a different output or a different image. Because based on the density of the subcellular organelle, it has different things. There's once a very old AIMS question which came, phase contrast microscopy, it can be used on unstained specimen also. I did not stain this. Fine, I can complete this because it's based on the density. Cell will anyway have different density. Based on that I can have, right? Unstained specimens, if I have to look at something, I can use a phase contrast microscopy, fine? This is something, and also it can give you the internal details of a cell. Because of the internal details of the cell, the variability, the phase contrast microscopy gives a different one. High fact team. Okay, that's about phase contrast, right? This is last but not least, just one more tiny variation of normal microscopy, fine? How many of you have 3D glasses at home? 3D glasses? I want you guys to comment. Let's make it a little bit non-academic. Do you have 3D glasses at home? Superman movie came recently. You must have watched it. You must have had 3D glasses. How many of you have 3D glasses? Not a great person to draw, right? Fine. If you have 3D glasses at home, you can use this to create an effect called as an polarizing effect or a polarizing microscope. Fine. So polarizing is a feature of light. That's all. Simple, normal feature of light. If you have been to 3D movies, you take the glasses out, you put it in, take out, put it in. You'll have different colors because 3D glass is a polarizer. If you have 3D glasses at home, let's say you have a simple normal slide here, right? Try this out. Okay. It's a beautiful polarizer. Take both the glasses out, keep one glass above the light source. This is my light source here. Keep one, I'll draw it black color so it's a glass, a 3D glass here, and keep one 3D glass here and turn them. It will reflect light in a beautiful way and make the things colorful. If you have a bone slide, use this. You must have read in physiology, no? And your anatomy. Bones will have lamellations. You can see those lamellations with the polarizing microscopy. You can see the lines in the bone because of the polarizing effect. Try it, you'll see even pathology is beautiful, right? It's not always looking at the corner of broken slide. You can actually learn something out of it. So this is just to understand, right? So where do we use polarizing microscopy in a pathology exam or in routine diagnostic workup, right? This might come in an exam, fine? Okay. Mohit, we'll look at electron microscopy sometimes later, fine? So polarizing microscopy, one, it's used in a disease called as silicosis. Silicosis is a lung disorder where something causes positive birefringence happen. Okay. Birefringence is a property of the light. So silica is nothing but sand. Sand particle gives positive birefringence. I have a disease called as gouty arthritis. In gout, I have something called as needle-shaped crystals. The gouty crystals will be needle-shaped and they are negatively birefringent. Okay, this also has come in an exam. Never forget. Third, last but not the least, I have a disease called as an amyloid. We'll read in the Nishchay batch soon about amyloidosis. Amyloid is a particle which has something called an apple green birefringence. Okay, so we have three uses of polarized microscopy. If you want to answer even the rarest of rarest questions, do remember them. Silicosis, gouty arthritis, amyloidosis are very good use case of day-to-day activities of polarizer. There are quite a few use cases not required for an UG level. But these are something which I never want you to forget, right? Just use a 3D glass is not the right polarizer, but 3D glass is a very cheap polarizer. If you have it at your home, you can try it out. Actually, polarizer is a instrument. You keep it on top of the under the microscope and you can have the effect. But if you don't have that, it's a bit expensive one. Simple 3D glass can use the job of polarizer, right? Okay, that's all for today. If you have any doubts, do let me know. We saw quickly about polarizer. We saw about phase contact, the use case. One course of stain is not for amyloid, Mohit. Amyloid ka stain is congruent, right? One course has a stain for calcium, okay? Birefringent, that's all. Okay, we saw about dark field microscopy. We saw about individual different parts of a microscope, what's the function, and this is a labeling of microscope. Once in AIMS exam, they just asked few A, B, C, D, put question mark for condenser and asked what is the question mark or marked part of the microscope. Might even come. Sometimes basic questions do come. Unfortunately, we stumble there. Fine. Okay, that's about the first series of inside the lab about simple normal microscope, right? In the subsequent series, I'll go with fluorescent microscope, electron microscope, few stains, few procedures, and lots more. Fine. It's okay, Mohit. It's completely fine. Not to be apologizing here. Fine. Okay. Thank you, guys. If you have any queries, do let me know. Otherwise, we'll call it a day. Fine. Thank you for your time.